The cases include 3 health workers, including one who has already died. The outbreak that was declared by the DRC Health Ministry on Tuesday is the DRC's 9th known-outbreak of Ebola since 1976, when the deadly viral disease was first identified in then Zaire by the Belgian-led team. Early this week, 17 people are suspected to have died from the viral hemorrhagic fever in Congo. Congo's Minister of Health had confirmed that 2 of the samples tested positive for the Ebola virus. Local health officials had earlier reported 21 patients with hemorrhagic fever in the village of Bikoro in Benke. 17 of the patients died later. The health ministry says that Nigeria is considering sending a team of health workers to the DRC to help contain the outbreak. Nigeria recorded its first case of Ebola in 2014 after a government official collapsed on arrival at the airport in the country's biggest city, catching health authorities unaware. After Congo's last Ebola flare-up, authorities had approved the use of a new experimental vaccine, a plan that failed to materialize owing to logistical challenges. The worst Ebola epidemic in history ended in West Africa just 2 years ago after killing more than 11,300 people and infected some 28,600 people as it rolled through Guinea, Sierra Leone and Liberia. Congo's remote geography also gives it an advantage, as outbreaks are often localized and relatively easy to isolate. Meanwhile, the Kenyan government has deployed 101 health workers in all the entry points following the outbreak at the DRC. Health Cabinet Secretary on Friday said 260 health workers are on standby as the government tightens the measures put in place to ensure the virus is not imported to the country.
We are here this morning and have walked around to assess our readiness in terms of preparedness to respond to any emergencies. And I am happy to note, as I appreciate my team responsible for this, that indeed we are prepared in the best way possible.
Kenya is ready to screen all the targeted areas where probably Ebola can come, but we are very far from the Ebola area. But I can tell you, we must be proactive. In
all these places, the Ministry of Health has installed the following: one, an electronic thermo screener or screeners where we need to have more than one. We have also brought in handgun thermo scanners. We also have brought in other support systems, including deployment of 101 health workers.
Ebola is believed to be spread over long distances by bats, which can host the virus without dying, and as the bat infects other animals, it often spreads to humans via infected bushmeat.